Hey, Michelle Weddle here, one of the co-founders of ASAP Pathway. For those that may not be aware, ASAP means Airway, Sleep, and Pediatrics Pathway. In our study club, we talk about anything and everything that has to do with dentistry and craniofacial growth and development, and anything really that can affect a child's airway and sleep. One of the things that's not really talked about when you're doing orthodontic development or myofunctional therapy is the relationship between the craniofacial growth of the bones and the teeth, the positioning of the teeth, the orthodontic positioning of the teeth, and the TMJ, the jaw joints. So today what I'd like to show you is, one of the things that I've found helpful in keeping track of two concepts in TMJ, which is the non-reducing disc displacement versus the reducing disc displacement, and how I use a TMJ tutor to kind of demonstrate that to patients. So as an orientation, again, this is a TMJ tutor. It's basically just a model of what the joints look like and their relationship to the teeth and to the upper and lower jaw bones. So here out of the microphone, these little splint things, it comes with these splint things that I'm going to put away because we are not actually going to use them in the explanation of what's happening when a jaw joint is clicking. But what we want to do is it comes with these three pieces. So you've got the upper jawbone here with the upper teeth. So it's got three pieces. It's A, N, and P. A is anterior. I'm going to put that aside. P is posterior. I'm going to put this aside again. And N is normal. So in a normal joint, right, what's happening is this is your upper jawbone. This is your lower upper jawbone, upper teeth, lower jawbone, lower teeth, and the teeth kind of jive together. The lower teeth connects to the lower jawbone and goes all the way up and ends in a ball that fits in a socket. In between the ball and socket, you've got this disc. I call it this little pillow between the two bones. So your ball and socket joint has a little pillow in between. When you open and close a little bit, you rotate that ball inside the socket, and when you open widely, it translates. So it's actually the only jaw joint that comes out of the socket during normal function. Now what happens when a click is happening is sometimes the positioning of, it fell, found it. Sometimes the positioning of the jaw, the positioning of the teeth does not allow the teeth, the positioning of the jaw bone, does not allow the teeth to jive together with this normal joint configuration. So what happens is the bottom jawbone has to kind of scoot backwards a little bit because the teeth will jive better in this position. When the bottom jawbone scoots back a little bit, this ball scoots back just a little bit more. Now what we know about this pillow here is that it's a very, very slippery disc, right? So the disc between the two bones is slippery to facilitate the joint movement. So I tell my patients, this little disc here is kind of like a bar of soap. If you put something directly on top of it, you can kind of keep it in place. But now if you're pushing on the edge of it, if you put your foot on the edge of a soap and put weight on it, it's going to slip right out. So sometimes when this happens, this ball is at the edge of this disc, and the disc is very easily slipped out. Now what happens is when they open and close a little bit, this ball rotates in the socket, and there's not much noise. But then when they open wide, now it kind of has to maneuver around and then has a click. I don't know whether that click is being recorded, is being heard, but that's kind of the same click that patients hear when they open their jaw wide, when they open their mouth wide. So that's basically the ball going right on top of the disc, or the disc is being recaptured. Again, right? It's opening and then going like this. And then coming back down, and then now the teeth are not jiving together again. We kind of close, and then all of a sudden, we're pushing on the edge of the disc again, and then the disc is very easily just slipping right out. And then here you're on bone to bone. when the disc is out, this is a disc displacement, right? So in this configuration here, this disc is no longer where it belongs in between the ball and the socket. So this is a disc displacement. So now we have a disc displacement scenario, and when we open and it pops right back in, it recaptures, well, it reduces, really. So a lot of the times the click is that the ball is going right back on top of the disc. So in this scenario where the patient is opening and closing and they're able to open widely and then go on top of the disc, click on top of the disc, this is called a reducing disc displacement. So just as a kind of primer, what are you thinking about when you're thinking about reducing disc displacement and non-reducing disc displacement? Because this is one of those things that I actually had a hard time trying to keep straight in my head. So if you take away the joint, for example, for now, and think about a bone. If you have a bone that's broken, you've got one bone that now has become two, right? You've got a broken bone. You've got a fractured bone. And if you want to fix that bone, you're going to reduce that distance between the two bones. You're going to reduce that fracture. So in my head, you know, when you're reducing something, you're putting it back into place. You're assembling it into the correct assembly. Instead of it being apart, now it's together. So you're reducing that fracture space. So here, when you have a jaw joint and you have a disc displacement, right? So the disc is out, and you have a reducing disc displacement, that means we are actually putting it back where it belongs. So that's a reducing disc displacement. Now, in a situation where you have a disc displacement and then the patient opens wide and opens a little bit and closes, this is your rotation, and then when the patient opens wide, they're not able to open fully because that disc is in the way and they're not able to maneuver that ball on top of that socket, that ball underneath that disc, then that's a situation where it's a non-reducing disc displacement, meaning we can't put the disc back where it belongs. In this situation, if it's an acute situation, most of the time what you're going to find is that the maximum opening is going to be restricted because this ball can't get to where it's supposed to go. The condyle can't translate all the way where it needs to go in order to manifest a full mouth opening, right? Because if it's non-reducing, then it's kind of stuck here. It's not going all the way and translating where it belongs. All right, so kind of in a nutshell, that is the difference between non-reducing disc displacement and reducing disc displacement, and that's how I use a TMJ tutor to show a patient or a parent these concepts so that they can understand it a little bit better without really seeing their joints and facilitating their understanding of what's happening in the situation. So I hope it helps. Enjoy your day.